And so thank you everyone for joining us this morning. My name is Choa. I'm a strategic projects and portfolio manager with the community engagement and strategic partnerships team under ODHS. I want to thank you all for spending your morning with us this morning for the Senate Bill 739 implementation plan review and discussion. We can go ahead and into the next slide. So today, this will be what we will be covering in this short period of time with you all this morning. I do want to say we want to appreciate your continued partnership as the work as we continue to implement Senate Bill 739 from planning into active rulemaking and operational steps. Since October, several components of implementation and adjustments have been made based on community and partner feedback. Myself, along with the APD leadership team, want to take this time to thank you for your participation in this process. Your input has influenced timing, sequencing, engagement planning, and how the rulemaking process was structured. Today's session is primarily a briefing. We will provide a progress on what's been completed, where we are in the timeline, and what's to be expected over the coming months. Since we only have an hour with you all this morning, we're going to move through a ton of information today at a steady pace. And so if you have any questions during the presentation, we encourage you to put them into the chat. We will hold a bit of time at the end of our time together to address some of those questions, but please know that if we don't get a chance to, or if time is out, we will be following up afterwards as well. Okay, I wasn't sure if someone had questions. I'm going to keep going really quick, and then we can dive into questions later on. And so thank you again for being here. Thank you for your ongoing engagement with us as we continue to move this work forward. And so we're going to talk a little bit about community agreements in the next slide before we jump into the details of the progress around Senate Bill 739 implementation updates. And so the first and foremost, be present and participate. We really do appreciate your feedback and the contribution that you provide us. Contribute thoughtfully and creatively. Engage with professional respect. Foster accountability and collaboration. Uphold a safe and inclusive environment. And then commit to growth and positive progress. Again, we do have a short time with you all today. We ask that conversations do stay focused on Senate Bill 739 and really focusing on the updates that we'll be providing today. I'm going to transition over to Carissa, who will start us off with 739 implementation.
Good morning, everyone, and welcome. I'm so delighted to be in space with you today, and thank you so much for taking the time to join us today. For those of you who don't know me, I am Carissa Neufeld. I use she, her pronouns, and I am the Deputy Director for Safety and Regulatory Oversight for the Office of Aging and People with Disabilities. I've been out on leave for a few months and am excited to be back to see the progress that has been made with the implementation of Senate Bill 739. Implementation of Senate Bill 739 is essential to strengthening our regulatory oversight and ensuring that older adults and people with disabilities are safe and have the quality options for the support that they need. This work is top priority for our regulatory and oversight team and for APD. We are committed to adhering to our timeline to complete implementation of Senate Bill 739 this year. As we have shared with you in other meetings, we have multiple safety projects and initiatives underway. Senate Bill 739 is a cornerstone of that work, and we have adjusted other projects to ensure we meet our timeline to complete implementation by the end of this year. That is why we are all here today. As Choa mentioned, your engagement is important to the success of our implementation in helping to ensure we're operationalizing the Senate bill as intended and as effectively as possible. Our team really appreciates everyone who has taken the time to share insights and feedback as we move this critical work forward. Today, the purpose behind our implementation table meeting is to share progress on APD's work, to strengthen safety, oversight, and quality, to share regulatory and rulemaking updates, to outline upcoming timelines and opportunities for engagement, and to continue to hear your constructive feedback. Next slide, please. I know we shared this slide during our February implementation table meeting, but for those of you who may have missed the meeting, I just want to take a minute to recap a little bit. APD in 2024 adopted a comprehensive plan for continuous improvement to safety, including processes to strengthen its oversight of licensed long-term care providers. Changes to date include implementing recommendations from consultants Alvarez and Marcel, as well as Human Services Group, to work on the and of course, our work on implementing Senate Bill 739. Next slide, please. So focusing in on Senate Bill 739 implementation, as we move into Q2 of this year, we have begun holding Rule Advisory Committee sessions that many of you have been a part of for all three of our rulemaking groups. That includes our memory care, our adult foster home, and our community-based care rule. As a reminder, we are doing temporary rulemaking, and they will be filed, our temporary rules will be filed at the end of Q2 for all three of the rule divisions. As the team continues to move permanent rule amendments through the rulemaking process, they will also be working to prepare internally and externally for temporary rules that will be in place by July 1st, 2026. This includes updating and developing trainings to be delivered to staff, developing communication messaging to staff and partners, and providing updated system changes. We will be providing further details regarding the implementation of the temporary rules as we move through today's presentation. Next slide, please. Looking ahead to Q3, outreach and engagement will continue as the team moves through the permanent rulemaking process, which is scheduled to conclude at the end of Q4. What this means is staff and providers will be informed and trained on rule changes as rulemaking groups near the effective date and will begin to operationalize those rules. At the same time, partners will be engaged along the way throughout the rulemaking process, as you have been, and we hope you will continue to be. We will be sharing our progress via the APD implementation table meetings, through provider alerts, and as additional communication needs are identified. We will respond, working together to meet those needs in collaboration with you. The permanent rulemaking process, as I mentioned, will end at the will end in Q4, and of course, we'll continue to be having the rule advisory committees between now and this or through this Q2. All right, I am going to now pass things over to Danny, who will share with you more information about our progress.
Thank you, Carissa. Good morning, everyone. My name is Danny Harris, and I use she, her pronouns. I am the SOQ Operations Project and Process Improvement Senior Manager. And I'm going to start by providing a quick review of our Senate Bill 739 implementation calendar so that we can all get our bearings as to where we are in the rulemaking process. So next slide, please. Oh, one more. Next slide. There we go. So here is the rules implementation calendar specific to Senate Bill 739. The 3 rulemaking groups are being implemented on a rolling basis. And as you can see from these first set of dates in each of these timeline boxes, we have just completed our first round of Rules Advisory Committee events for each of these streams, including memory care having their first RAC yesterday. And so as part of that, the SOQ program managers will provide a high-level overview of some of the feedback and themes that were observed as part of this first round of RACs. We will start with Lynette Ross to provide a high-level overview as part of the adult foster homes first RAC, who will then be followed by Sudha Landman to discuss the same regarding community-based care, and I will follow up by discussing memory care community themes. So next slide, please, for Lynette.
Good morning, and thank you, Danny. As Danny mentioned, we are working on a temporary rule, but we're also working in companion with a permanent rules process at the same time. So that's why we're having RACs in advance of temporary rule going in effect on July 1st of this year. So we have amendment rules or amendments in place to streamline several processes. We're adding the 90 to 101, my goodness, 90 to 120-day inspection requirement for newly licensed adult foster homes to help with that support early on as they've become licensed. And the Senate bill also allows for homes that have had a 3-year history of substantial compliance to renew their license every 2 years rather than annually. Next slide, please. So themes for consideration in the future as we're moving forward, the scope of the mid-cycle inspections. So statute does specifically call really everything that we do an inspection. And then what we're tasked with defining is what the scope of those inspections are. So sometimes they'll be called monitoring visits or investigations or inspections or, other words may come into play, but really statute defines everything we do as an inspection. So we're using policy as our tool for defining the scope of those so that each office conducts them equitably. We are also looking at the phone requirements in rule. We had initially just crossed out the landline requirement and just indicated instead that there be a phone available. So the landline, having a phone is not a new rule. We were just trying to address the fact that as technology has changed, not everybody has access to a landline. So we are continuing to tweak that language a bit as well to make sure it reflects the standards we're trying to have in place. Next slide. Oh, and that is my chance to turn it over to Sudha. Thank you, Sudha.
Thank you, Lynette. Good morning, everyone. My name is Sudha Landman, and I use she, her, hers pronouns, and I am the program manager for community-based care, that's CBC program. So on this slide, what we have is just a snapshot of what happened with rulemaking group 2, which was centered around CBC. And some of the main features were regarding streamlining process and really outlining the process for LCU, which is our licensing complaint unit. And it outlines what needs to be in the report. It outlines timeframes for the licensing folks. Also, it requires for facilities to be able to notify residents whenever there's a substantiated allegation, violation. So that is something new as well. And much like the AFH program, it does require the department to inspect new facilities or to survey new facilities sooner than prior timeframes, of which, they were big timelines back in the day, but with SB 739, it's more outlined as to the when that we need to go back, which is again 90 to 120 days, like Lynette just mentioned for AFH. Next slide, please. The RAC that happened on March 25th, some of the observations to bring to your attention are we heard that folks wanted to keep our definitions in alignment with memory care, with adult protective services, and others, including building code division and law enforcement agencies. So that was something that was relayed to us, which makes sense. Also, additional clarifications for facility notifications. So things that are issued directly to the facility, there was more that was needed to be understood around that. So we will be doing all that in the upcoming racks because this was just the first one. And lastly, one of the things that was offered as a suggestion was to restructure all notifications to be in one section. So at this time, we're reviewing all the recommendations that we have received, and we're taking them into consideration for any and all improvements. And any adjustments that we do make will be flagged and shared with you all at the next rack. So with that, I'm going to hand it over back to Danny to discuss memory care rack observations. Thank you.
Thank you, Sudha. So rulemaking group 3 is memory care communities. It amends rules to develop stronger standards for regulating memory care endorsed facilities. These standards include administrator dementia training requirements, procedures to follow during an emergency closure of a facility, and procedures for when a resident leaves a facility unnoticed, also known as elopement. Next slide, please. There were 5 themes that the rulemaking team observed as part of this initial RAC. Number 1, alignment with existing rules and regulatory frameworks. So similar to what came up in the CBC RAC, participants emphasized the importance of consistency between Division 57 and existing requirements in Division 54, building code requirements, fire and life safety standards, and professional licensure oversight. So really this team reflects the need to avoid creating conflicting regulatory expectations across systems. Examples include alignment of terminology such as evaluation versus assessments and what those implications are for registered nurses, and also consistency with building and fire code requirements related to egress control and window function. The second theme is in regards to fiscal and operational impact of safety-related requirements. Participants raised concerns that several of the proposed safety provisions may have greater fiscal and staffing impact than what is currently reflected in our draft fiscal impact statements. So this theme signals the importance of ensuring fiscal impact estimates are well supported and clearly communicated. Examples include potential staffing implications related to supervision of exits during emergencies and additional drills, and any possible physical plant modifications. The third theme that was apparent is the need for clearer definitions and the reduction of subjective terminology. So participants frequently requested clarification of terminology to support consistent interpretation and enforcement. Examples being phrases such as timely, reasonable, and routine, and clarification of dementia-related terminology was also discussed. So this theme highlights the need for specificity to promote consistent understanding across providers and surveyors. The fourth observation, implementation considerations related to family council requirements. Participants discussed how prescriptive the rules should be regarding structure and process requirements for independent family councils. So this theme really reflects the need to balance statutory direction with operational flexibility, such as the level of specificity related to posting requirements and how would facilities operationalize requirements when a family council does not yet exist. And finally, balancing person-centered language with regulatory clarity. Participants expressed interest in ensuring terminology reflects person-centered principles while maintaining clarity and consistency with existing regulatory frameworks. So this theme reflects the importance of language choices that support both clarity and alignment with broader policy values. Examples such as requests for people first language related to dementia and clarifications to terms such as resident, visitor, and representative. Next slide, please. So in addition to the rulemaking aspect of implementing Senate Bill 739, there's a great deal of intentionality around how the department intends to socialize and operationalize changes related to Senate Bill 739, both internally and externally. Very specifically, we need to prepare for the temporary rules that will be in place and in effect come July 1st, 2026. As part of this outreach, we asked SOQ leadership for each of the 3 rulemaking groups to answer the following questions. What is being implemented? What changes should providers prepare for between now and July 1st? What is the timeline for training of internal APD staff? And what is the anticipated date for operationalizing these changes? So here to answer those questions for each of the 3 rulemaking groups is again Lynette Ross, Sudha Landman, and then myself. So Lynette will start with adult foster homes. So next slide, please, for Lynette.
Yeah, great. Thank you. So, in the question of what is being implemented, and some of this is being asked about in the chat, is we are developing policies for licensors that are specific to the scope of the 90 to 120-day visits and how those are to be conducted, as well as the guidance for renewals and what we're calling a mid-cycle inspection, which is effectively that midpoint visit on a 2-year license. So those are still in draft form. We're not quite complete on having those done yet, but we are working on it. And then what we will do is as we have those drafts done, we will connect with the provider associations. We'll have a meeting just as we did on the parameters for substantial compliance, where those who were able to join are able to give some feedback and some input on those policies themselves and help us to bring them towards being finalized. There is also a component to Senate Bill 739 that requires that there be policies in place for on 8 specific topics in adult foster homes. We have created those policies ourselves for you as providers, just as Multnomah County did, and those are available to print and keep as part of your records. Or if you choose, you may write your own. Licensors will just be reviewing them to make sure they don't conflict with rule. And we do have a recorded training in that in Workday Learning that is available, so that can be accessed and people can understand their the requirement itself, though it isn't in effect until July 1. And then we're viewing this as a heavy technical assistance option, through 2026 as we continue to socialize this requirement and help providers to become familiar with the changes in Senate Bill 739. Next slide, please. So as far as what needs to be prepared for before July 1, I would say it's just a matter of understanding that even if you are a long-term provider and you open an adult foster home, it will put you likely in that window of having that 90 to 120-day inspection at your adult foster home. And as we begin to conduct renewals after July 1, providers who are eligible for a 2-year license will need to submit that additional bid
Zoom
fee
meeting.
for the second
I'm
year
okay.
in order to be able to be issued that 2-year license. Do I have the next slide as well? I don't know how far I go. I think I do. Yes. Okay. So the timeline for training internal APD staff, this is a little bit of a staggered approach. So we're looking at next month for training on the 90 to 120-day review requirement, which means we need to get that policy finalized and we need to get that provider engagement on what that looks like. Biennial licensing starts July 1, which means we're looking to train on it June at the absolute latest. And then we have a little more time on that mid-cycle audit process, since technically mid-cycle audits won't begin until 2027 when two-year licenses hit their midpoint. So that is going to be our staggered approach with training internal staff. And then combined with this, we will make training available and have calls with providers on the policies themselves, what the licensor policies look like, what they can expect from us as the state. If there's any forms changes, we are working on some forms updates as a result of Senate Bill 739. And then also just a training on the new rule updates themselves so that we all have that same information. Next slide, please. So operationalizing the changes, again, the 90 to 120 day reviews and biennial licenses go into effect July 1 when the temp rules go live. And then the mid-cycle inspections will start next year as those two-year licenses hit their one-year point. So grateful for a little bit of a stagger there. This is a lot of work that is being done, and we want to make sure that we're thoughtful and that we're engaging and that we have opportunities, for input from the provider population as we take these changes forward. Next slide, please. And that is my chance to turn it over to Suda. Thank you, Suda.
Thank you, Lynette. Hello again, folks. I'm going to walk through what's being implemented already and what providers can expect. So this basically focuses on the survey unit and what they are currently doing. They have already started scheduling their upcoming visits based on our new requirement. In other words, they are now scheduling according to the renewal date of facilities. Rather than what used to be not too long ago, which was they would go by the two-year cycle. So again, they are scheduling based off of the license renewal date. What this does is it does not impact kitchen surveys, which happen. That's going to go on as usual annually. So the temp rules, as was noted, will be in place 7/1. But providers don't have to worry about, being cited for something that they're not prepared for, because essentially the changes or the big changes that have been noted in SB 739 are a lot to do with our processes in-house. In other words, it's about timeframes and what steps we need to take and things of that nature. So that's just something to bring up, that even though we are scheduling already as of January 2026 in the way that SB 739 states it, this shouldn't have impact on providers in terms of different citations. One second. And I did want to say something about the 3 months noted over here, as well as the prioritization. So currently, the prioritization that survey is using when they schedule is they're looking at the renewal date, which was already mentioned, but also they're going by the change of ownership date, as well as then they have the management of current backlog. So those are the three basic priorities. And the last note here says surveys completed within 3 months of renewal date are credited. And what that means is, for example, let's say a facility had a January 1st renewal date. Let's say they got their paperwork into us, but in that situation, we had already done, hypothetically, a full survey in, let's say, October 2025. That October 2025 survey would get counted. So all that to say, if it's been within 3 months of renewal date, it would get counted. And this is just to avoid redundancy and just to be able to ensure better stewardship of resources. Next slide, please. Okay, so we mentioned the change of ownerships or surveys related to CHOWs. And it was also noted prior that we're working to already have them be between 90 to 120 days, because that is what SB 739 states. What we're doing internally just to make sure that we're streamlining this process and actually able to accomplish what we are setting out to do. In order to make that happen, we have become very intentional about having a feedback loop between our licensing specialists and our surveyors. So they have weekly meetings where survey gets a heads up that these are the following, facilities that are ready for chow or change of ownership, and accordingly survey can do their scheduling. And the last note here is that there was an alert that was sent out March 3rd, which outlines the time frame or the survey intervals information. Okay, next slide, please. So in terms of what changes are happening already, the survey events, like we said, are already aligning with the renewal licensure date. So that part's happening on our end. And additionally, we did have a training hour recently where Katie Gaffney and the rest of the OPA team did speak to the changes that we just talked about, the 90 to 120 days and scheduling based off of licensure renewal dates, etc. Okay, next slide, please. So what's the timeline for training? The current team is already fully trained at this point. However, we have received new positions, and we're in the process of recruiting. Once we have those, of course, there will be a gap in terms of there's going to be a learning curve because our new hires will be getting trained up as well. But currently, who we have, they've all already been fully trained. And typically for survey staff, it takes something like about 9 months for them to be fully trained up. Okay, I think I have one more slide. Yeah. So the anticipated date, again, in terms of operationalizing, like we've noted, we are already doing scheduling on our end. To that end, we've already started doing much of this work. And we're building our operational capacity by recruiting more folks. So that's in terms of survey. I'd like to add just a bit about LCU as well, the Licensing Complaint Unit. They are also in the process of recruiting new hires, and they, as well, as we noted in probably one of our earlier slides, their work has been greatly detailed and outlined in SB 739. As those of you that are familiar with Division 54, we didn't have much which stated work around licensing complaint unit, at least not to the level of detail as SB 739 has it currently. And some of the changes, just to quickly bring up, are an on-site complaint investigation has to happen within 24 hours or before the end of the next business day. In cases where there's a complaint that alleges a licensing violation resulting in death. So that is something, again, that LCU is already watching out for, already implementing. And then also SB 739 asks that they interview all available witnesses and that those interviews need to be conducted privately. So that as well is in process by LCU, or Licensing Complaint Unit. Also, SB 739 talks about investigation reports and what need to be the primary components of that report. Much of it was already being done by LCU, so there's, again, no major change there. So they're going to abide by what SB 739 notes. So that's already in current operation. And lastly, with the facility, what is needed is a written assertion of substantial compliance once the facility has remediated the violation. In other words, once a situation has been fixed and the facility is ready for the department to come back to do a survey, they will submit that to the department in written form. And then within 5 calendar days after receipt of that assertion of compliance, the department will determine whether the facility has achieved substantial compliance. So that as well is in process already by LCU. I'm doing a quick check here just to see. And so basically what's going to be different for providers is just that they can you all can expect an on-site investigation within 24 hours in a situation of death, which is tied to a licensing violation. And for facilities that have asserted compliance, that written assertion will go to the CAC, which is our corrective action coordinator, and then LCU will initiate an investigation. So with that, I'm going to hand it over to, I think, Danny.
Thank you, Sudha.
Welcome.
So what is being implemented for memory care community? I want to take a moment here to quickly mention Senate Bill 228, as that is being included in the draft language alongside Senate Bill 739. So Senate Bill 228 aims to provide better support and communication for those with loved ones in dementia care settings through the establishment of family councils. I just wanted to provide that clarification for language around family councils as part of this, as you won't find it referenced in Senate Bill 739. Facilities have been implementing family councils in alignment with Senate Bill 228 since fall of 2025. We are just adding these requirements alongside Senate Bill 739 as they both impact residential care assisted living rules. So the rules carried out in Senate Bill 739 and Senate Bill 228, making cleanup edits and providing clarity to memory care endorsement rules. And they clarify expectations in 4 areas. The first is safety and oversight for residents with dementia. So facilities must have clear policies and staff training related to elopement prevention, egress control systems, admission decisions, and emergency planning. Number 2, administrator knowledge of dementia care operations. So administrator continuing education must include specific topics related to dementia care oversight, including elopement risk, admission decisions, and emergency planning. The third one is family councils. So residents and families have the right to form independent family councils, and facilities must support council activities while allowing councils to remain independent. And then finally, dementia supportive environment. So rules clarify expectations for environmental features that support safe movement, reduce confusion, and help residents remain as independent as possible. Next slide, please. Most providers will not need to create new programs. However, many will need to review and update policies, training, and documentation practices. And so facilities may need to create or update policies that address safe wandering and prevention of unsafe elopement, how egress control systems are monitored and tested, staff response when a resident leaves without staff awareness, how admission and transfer decisions are made for individuals with dementia, how care will continue during emergency evacuations or closures, and how the facility supports independent family councils. Next slide, please. So other changes will relate to training and documentation updates. Facilities may need to update training for administrators to include those new requirements required for dementia care oversight, new training for staff who respond to elopement or monitor egress control systems, staff involved in admission and reassessment decisions, and staff who support communication with family councils. Next slide, please. Environmental review changes. As part of this, facilities effort will involve updating policies, updating training content, and confirming documentation practices. These changes are not expected to require major physical renovations. Next slide, please. So what is the timeline for training internal APD staff? So rule language is expected to be finalized May of 2026. So May and June begins development and implementation of guidance and training. Survey leadership will be involved to support consistent interpretation, and providing training and guidance before that July 1st temporary rule implementation will help reduce confusion and reduce provider burden. Next slide, please. Anticipated date for operationalizing changes. Again, once rule language is finalized in May, staff can begin developing training and guidance content. Providers can expect to have written guidance, provider training hours, and provider alerts through May and June in intense anticipation of the temporary rules being in place July 1st, 2026. Next slide, please. We heard from many implementation table participants, both during and following the last implementation table, the many concerns and feedback related to our long-term care website. And at that time, we were close to launching that new website, but it wasn't quite there yet. And so we thought it would be helpful now that it has launched to circle back to this topic and provide a demonstration of this newly launched long-term care website. And so with that, I will turn it over to Cassie Studer.
Hi, good morning, everybody. Give me just one moment to share my screen. All right. All right, everybody, this is our newly updated long-term care settings search website. This website provides the public with access to provider profiles, inspection reports, substantiated violations, and regulatory actions. And the information on this website is updated every 24 hours. So here, when you go to the website, this is what we're calling the home page. Up at the top, there is a few tabs, and we'll go through each of these individually. There's provider search, a view data, about the website, and a contact us. On this homepage here, you can also access a list of providers, a map of providers, and then the information about this site. And I'll get into more details about each of those areas. Additionally, we have links to the consumer summary statements for assisted living and residential care facilities. Our ODHS APD licensing update website, which is a website that contains a list of providers requiring additional oversight, a link to the ADRC, or Aging and Disability Resource Connection website, and then some quick links here all the way down at the bottom: our Oregon Department of Human Services website, our Licensing and Oversight website, Aging and Disability Resource Connection, Intellectual and Developmental Disability Services, How to Report Abuse or Neglect, the Long-Term Care Ombudsman, and the Federal Nursing Home Compare website. So I'm going to scroll back up to the top here, and we're just going to start with the list of providers. When you click on that list, it shows all of the providers. What is new and super exciting is now you have up here, these little funnels are filters that you can filter by facility program types. So if you just wanted to see all the adult foster homes in Oregon, you can click that little checkbox next to AFH and hit apply, and that filters your results to only show adult foster homes. Similarly, you can clear the filter, and that will put all of the providers back. If you're just looking for assisted living or residential care, again, the same. It does that filtering for you. We also have additional filters by city. So if you want to find a specific city, if you're looking for a provider that accepts Medicaid, either so you can filter by yes, they do, or no, they don't. Memory care, if you're looking for a location that provides memory care services, you can hit this filter and hit yes, and that will pull up all of the memory care locations in the state. Additionally, it has status here, and this it defaults to any provider that is open in the state of Oregon. If you want to clear that because you want to see closed, you just hit the clear button, and it'll also show you any provider that has since closed. Okay. And I'm just going to pick one here. This is the facilities profile. So at the beginning here, you have the provider information, the address, the name, the phone number, a contact email, who the administrator is, the type of home, the classification, and down here on all adult foster homes, there is a link to learn more about the adult foster home classifications, what their licensed bed capacity is, if they accept Medicaid, and if they are in memory care.
Hey, Cassie, are you
Yes.
able to drop the link for the website that you're on in chat so folks can follow along?
Sure.
Great, thank you.
We'll get that posted in there in just 1 second. Let me go back to where I was at. So up here at the top, you see different tabs. The next tab is the inspection tab. This is for any inspection that the state has conducted at this location. You can filter by dates. You can filter by how many, if you want to see how many sites have deficiencies have been cited. Actually, close that. And then when you click on the event, it now just does a pop-up, which is really kind of nice. And you can click on any of these to see the details about that specific violation. Additionally, you can print, and you can also do a records request, and this will pop up an email that will email our records request unit requesting a copy of this specific report. Okay, the next tab, and this is new, we have separated into 2 different tabs, abuse violations and licensing violations. So the next tab over is abuse violation. This particular provider does not have any. And the next one is licensing violations. So the abuse violations will look very similar. It has the allegation, the level, and when you click on it, it does a little pop-up and gives you more information about that specific violation. Additionally, it does give you a link that is clickable to the related OARs, or Oregon Administrative Rule, that was violated if you want to know more about that specific OAR. The next tab is regulatory actions. This tab will list any conditions that may have been placed on that provider's license, and they date back records to 2010. So here, I'm just going to click back to the list to go back to the list of all the providers. And then I wanted to show you something a little bit specific to community-based care, so assisted living and residential care communities. These particular records, facility profiles, also have an additional tab called Quality Metrics. And when you click on this tab, it takes you to information regarding the Quality Metrics program and links to the available reports for that program. I'm going to go back to the list, clear that, and I wanted to highlight something specific for nursing facilities. For nursing facilities on the inspection tab, we have a little disclaimer down here at the bottom. The information on this tab comes from a database called iKeys, which is managed by the Center for Medicare and Medicaid Services, or CMS. Sometimes CMS changes how the data is organized. And when that happens, the information may not show up on here until our system is updated to match those changes. So if this tab happens to be empty, or you have questions about a facility survey for a nursing facility location, there is an email to contact for help with that. Okay. And now I'm going to go back to the home page, and I'm going to go to the map of providers and show you a little bit about what we can do with the map. So for the map of providers, you have some filters up here. You can filter by type. So if you want to just see maybe assisted living and residential care, that is all of those in the state of Oregon. Maybe you're looking for, yes, they do accept Medicaid, and you're looking for a memory care. So it really can drill down to some of those specific details. And if you're looking for a particular area, you can click on any of these and it goes to, it'll pop up what that provider's name is. And you can go to the provider's details from this map. Also on the list of providers, I did miss this, you can download and export your search results, which is a new feature. This was highly requested. So you can download as a CSV file or an Excel file, which gives you just the basic information that's on this sheet here. The view data is a compilation of all of the inspections that we have listed on the website. So it has everything. You can download results. You can search by date. You can add in some filters if you'd like. And you can export those results. The About starts up at the top with just some basic provider information, a glossary of the common terms, more information about what those adult foster home classifications mean. And then it also has the definitions of abuse and some links to the Oregon administrative rules and a website about preventing adult abuse and neglect. And then, of course, there's the Contact Us, and it gives you several ways to contact each of stuff about the website, public records, and then each of the programs that we have in our office.
This is Cho. I do want to do a really quick time check. We have about 5 minutes left with our time here. I do want to also use the time to address any questions that hasn't been answered in the chat as well. If you have any further questions, any other feedback that you'd like to provide for the licensed long-term care settings website here, please include that in the chat. If that's okay, Cassie, for us to go ahead and shift gears.
Yep, absolutely. Thank you so much.
Thank you. So again, if you have any feedback, if you have any questions about the licensed long-term care settings web page, please provide that into the chat for us. I believe all the questions that has been shared in the chat has been addressed. I do just want to give a couple of minutes for any other folks who feels like they need to get more clarity around their questions. If you want to go ahead and raise your hand, we can call on you. Oh, Carissa, go ahead.
I did want to just respond to a couple questions regarding the 24-hour response to a complaint involving a death. So I don't think I necessarily saw a response, but just to clarify, so Senate Bill 739 does require the department to respond to go on site to a residential care or assisted living facility when there has been a death that may be attributed to a licensing violation. So when there's a unexpected death, facilities are expected to report that to the department, and then again, if there's a concern that there may be an allegation of a licensing violation that contributed to that death, then our licensing complaint unit is expected to respond. So I just wanted to clarify that question. There is for folks who want to file a complaint, residents, community members, other professionals, they can contact our complaint line, or there is an online form that they can also file. So perhaps one of our team members can put a link for the complaint form in the chat as well. But that's what that comment was about when I believe Suda was presenting. Thank you.
Okay, and then the other question that just popped up was in terms of the website. Will it be available to the public? Thank you, Lynette, for responding. The website is public. So that should be available. And let me see. Anything else? Lynette also included the complaint form link in the chat as well for those of you who may need it. Other than that, if there's any additional questions, the team will come together, pull that together, and follow up and send that out as well. We have about a minute left, so I'm just going to hop right to the end. We want to also let you know that the next session is scheduled for June 4th. That's a Thursday at 10 a.m. As we get closer to that time, we will send out reminder announcements to register, as well as reminders that will get closer to the date. So before I end this call, I'm also going to include this particular email into the chat. So if you have any other questions, if there are other topics you'd like for the team to address during one of these implementation table sessions, please feel free to email us. We will take a look at those and incorporate those into the next, those topics into the next session as well. Before I end, Danny, Carissa, any other final words?
I don't know if we're able to pull up the slides, but just a reminder of upcoming dates for these implementation tables so that folks can put on their calendars for the next one. There it is, June 4th, 10 a.m. We hope to see everyone then.
And I would just like to close us out by saying thank you again to everyone who joined us today. We really do appreciate your interest and engagement. It helps us to make our system stronger and ensure that we are implementing Senate Bill 739 with the spirit and intent that it was intended by the legislature. And certainly we want to make sure that the new expectations are clear and operationalized effectively and efficiently. So again, thank you to all of you for being present today and for your continued engagement. We'll look forward to seeing you in June.
Thank you.
Take care.
I'm going to stop recording now.